What's up, everybody? I'm Craig with Echo, here with personal training extraordinaire Travis. I'm going to be talking through one of the best special tests to diagnose from a movement dysfunction standpoint several different things. This is a great test if somebody comes in and they're having knee pain, if they're having low back pain, if they're having hip pain. This is going to be the biggest bang for your buck to find some stuff to work on right away to help that happen. So the test we're going to be going over today is the Thomas test. We're going to use Travis here as our example. So what I'm going to do is I'm going to have him sit with his bottom on the very end of the table, legs hanging off. So scoot even out a little bit further for me.
Yes, sir.
Like just
keep going.
Yeah, keep going. Almost where you're going to fall off. Yep. And then from there, you're going to lie back and hug both knees to your chest as tight as you can. So now in this position where we start, I usually just take a quick look to see if they can get full knee flexion on both sides, if they have good hip flexion on both sides. Quick thing to check is like, how does it feel on their low back when they're in this position with both knees to their chest? So how does that feel on your back?
A little bit tight, but
a little bit tight.
That's normal.
So a lot of people, if their Thomas test is abnormal, will have back pain because of extension and rotation or instability. So if they bring the knees close to the chest, that kind of helps lock out the lumbar spine. So it might feel a little tight in the muscles, but it also might feel like a nice stretch for him. So to start the Thomas test, he's going to hold on to his right knee, and we're going to let this left leg fall. Now there's a couple of things we're looking for. Number one, we're looking at knee flexion. So how much flexion does he rest in? So this is indicative of rectus femoris or quad tightness. If he is kind of out here, that's a pretty good indication that his rectus femoris is tight, and that is often linked with that patella pain. So when you have people have patella pain when squatting, it could be due to rectus femoris tightness not allowing their patella to move like it should or their kneecap to move like it should. So you want to see close to 90 degrees of flexion with them just resting without like contracting their hamstrings or anything. The other thing we're looking for, and you want to make sure they're hugging that other knee as tight as they can, because you want to see the thigh resting on the table. Now you want to see the thigh resting because if not, and as you can see here, there's quite a bit of distance. This tells us that Travis has some tightness in his primary hip flexor, which would be his iliopsoas. Now that is where you see a lot of back pain generated from, because if that muscle is tight, it's going to pull the lumbar spine into extension and rotation whenever they're trying to do any type of activity like squatting, or you see it a lot with people, especially after they've been sitting for a long time and they complain about how their back hurts right when they stand up. Now, the other thing that you're looking for here is sometimes I take their knee and straighten it out and then kind of let it fall again. And sometimes you'll see their hip kind of slip into abduction. Now, if their hip slips into abduction a little bit, that tells us that there's some restrictions in the TFL, the tensor fascia lata, which runs into the IT band. So if you have runners who are coming in and they're complaining of knee pain or hip pain, sometimes it can be due to the TFL dominance over hip flexor and quads. So you want to check that out, and that gives you kind of a good basis of, okay, what are some of the things that we can immediately start tackling, and we can go ahead and switch here, to help improve knee pain, back pain, or whatever type of hip or lower extremity pain your patient may be having or your client. So that's the Thomas test. Pretty easy test, pretty quick once you get it down. It can really help you kind of narrow stuff down really quickly. Thanks.